Okay, so good evening, everyone, and I hope that my voice is clear. Any problem with the sound? Before we start? Kindly just write in the chat if you hear my sounds clear and everything. So we start the session. I think it's okay. Okay, Bismillah. So today the session is regarding the history taking, and why I talk specific about history taking, because I think most of you know how to take a history. This is actually one of the skills that we keep practicing since being an undergraduate. But because I noticed some issues even in the practice, and history taking is one of the important sessions, because I think, especially in the upcoming exam, maybe one or two stations will be history taking. So, and mostly it will be combined with other stations, and that's mean that you have to master this skill, okay? Because there is no much time for you to keep remembering what shall I do, what shall I say, whether what's the next question, or all of this issue. Okay, so it's very important, extremely important station. And today I'm going to talk in some points regarding the skill itself, and after that we will start to cover the commonest topic. Okay, and maybe I will, when we do these sessions, maybe you need someone also to make a little bit communication and conversation. Okay, so the first thing for the sessions of the history taking is to read the instruction. Before you rush into the station, you have to read the card well, okay? Because sometimes there is an important information will be mentioned, okay? Maybe also they will mention if there is anything else you are supposed to do. So when you have this preparatory station, you're going to prepare yourself, you're going to make a plan for your approach. Okay, so this skills will be history and plus examination and plus explanation, or plus differential diagnosis, or plus something like that. So when you are writing, you are making this plan. Okay, so you know what are you going to do. So this is the first point. Then we come to the techniques. I'm not going to talk about the introduction that all of you use. I'm going to talk about some points. The first and one of the important technique is the open and closed questions. Okay, so for the history, try to be natural as much as you can, and try to practice with this role player or the actor as you are practicing in your own clinic. Because if you practice as being natural as much as you can, you will not miss points regarding the communication, and you will be able to elaborate taking everything from the patient. So, and that's why we are going to the open and closed question. Usually the target of the open question is to let the patients elaborate and talk in details, and expose if there is any hidden agenda, anything in his mind that is not be able to be covered. So we're starting usually by tell me more about your complaint. Okay, so this is the main complaint. As you know, in our stations in the DOHNS, we are separate, we are different from the other exam, for example, the PLAB or something like that, because usually for the NT clinic, all the patients are referred from the GP. So at least you know what is the problem with him. Okay, so you'd like to tell me more about your complaint. This is the first things. And when you ask this open question, you have to active listen to the patient. Okay, active listen. Why? Because if the patient's mentioned some points, you don't have to repeat asking him again about it. Okay, and you should put all the points that he mentioned. Maybe he will tell you about the complaint and the onset and Is it one side? Is it both sides? Maybe you talk about how does it affect his life? Maybe anything like that in this open question. So you have to be focused and listen carefully to every word and everything he mentioned. So it is not like a tick, I asked an open question. No, you have to follow the patient's complaint. Then we will come to the closed question. So I started, for example, for these patients came in with hearing loss. Okay, so Mr. Tom, I understand that you have been referred to us because of the hearing problems. Perhaps you could tell me more about your complaint. So the patients start to talk about blah 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 1, 2, 3, 4, 5, and talking about the problem of hearing and everything. So now there'll be this next step is the closed question. And I prefer for the closed question, you can do something like a signposting technique. Okay, like when it comes, for example, you say, okay, so Mr. Tom, when it comes to the hearing problems, there is some key point question that I'd like to ask also. Have you had any ear discharge? Okay, any fullness, any ringing or noise inside the nose, any feeling of dizziness or instability? So this is a closed question and you are anticipating yes or no, yes or no. So I start with open question, then I will give some many closed questions, okay? And after that, I got the points that I'd like to understand. We'll go to the next step for the red flags. Usually the red flags, if you have a red flags in the stations, you have to ask also a closed question. You can go direct to the red flag, but also you can give us something like a signposting also say, okay, and regarding the hearing problems, there's some points would like to ask to be sure that everything is okay. Like, have you had any nasal problems like blockage, okay, any bleeding from the nose? So we are excluding the nasopharyngeal problems and these serious things, which may be a red flag for this history taking. Then we'll come again to the open question, okay, for the eyes. I prefer to ask about the eyes, ideas and concerns and expectations in the history of present illness, okay? So and I will talk in details about them. Then we'll go continue the next point. So the first points in the history taking is the open and closed question. You have to balance between both of them, not to keep asking a lot of open questions because you will end by missing time, okay, because maybe the actor keep talking about something irrelevant or something would just keep wasting your time without any benefits for you. You're not able to detect the history. And also the closed question, it is not advisable to depend only on closed question because sometimes there is a points in his thoughts or some concerns or expectations you have to cover. The next point, the history thing, is a signposting. A signposting, it is not necessary to be between history of present illness and past medical history, for example. A signposting, it's the value of it is giving an introduction for the patient. So to understand that now we are going to another point, because just an example, if you are talking about a hearing problems, okay, and suddenly go to ask about diabetes or blood pressure, or if I'm smoking, a smoker or taking alcohol. So you have to just give this introduction that the patients understand. Now we are going to ask some other questions, or why you are going to ask about these points. Like we have different techniques for the signposting. Like, for example, when you have a patient with a sense of lump in the throat, and you are going to ask about red flags like weight loss or coughing of blood cough, or hematemesis, or change of voice, or something that may scare the patients. And you understand why I'm just having something sticky in my throat and I came to take a medication for that issue. So why ask about this issue? So this is the rule sometimes for the signposting, okay? And you will, for example, say, okay, so Mr. Tom, when you're coming to you complain of there is some important points that I'd like to ask to be sure that everything is okay. Like, have you had any change of voice, any lump in your neck, anything like that? So you give them an intro, like for example, for the medical history. Okay, so now I'm going to ask you some questions about your health in general. Have you had blood pressure, any anxiety disorder, diabetes? Have you had any surgeries before? When you come, for example, for the psychosocial history. So, Tom or Mr. Tom, I'm going to ask you some personal questions because sometimes it can impact your life. Okay, are you a smoker? Taking alcohol? What do you do for a living? Okay, and if you're, for example, going to ask about a sensitive question, and I'm going now to ask you some sensitive, some personal question. It may be sensitive because it's also related to our plan of treatments. Are you taking any recreational drugs? Okay, for example, the patients came with crustaceans, or you are suspecting he took any recreational drugs. So this is the value of the signposting. So when you're taking history, you have to depend on the open and close question. You have to do signposting. Okay. So all of this will add a lot in your communication. Okay. And making rapport and making the scenario run smoothly. Okay. Between you and the patients. Okay. The third point I'd like to talk about is the ICE. Okay, ideas and concerns and expectations. And before we talking about the ICE, I'd like to elaborate why we have to ask about the ICE. Is it something just to do a tick like, okay, ideas, concern, expectations? So why you ask about the ideas and concerns? Because it's very important to know, to get the perception, the patient's perception. What does he know about his condition? What is the hidden agenda? What is his expectations from us? Because sometimes, and I said these things yesterday, maybe the patients came with having any complaint like hearing loss or dizziness, and you think that he has a brain tumor, okay, or maybe he has a feeling, some kind of dysphagia or any nosebleeds, and he's thinking about the cancer or blood disorders or leukemia or something like that, okay. So, and when you are taking the history, you didn't cover these issues. So if the patients go home and without exposing these points, he may feel that there's a point that maybe doctors forgot to ask about it, or maybe doctors is not aware about it. Okay. So that's why we have to know what is the thoughts, what are the thoughts he has in his mind regarding the symptom. This is the ideas. So for the ideas, you can ask something. There's a common question like, okay, what do you think it might be the cause for that? Okay, this is maybe he will say no or something, or maybe another question like, what are the thoughts in your minds regarding these symptoms? Okay, so this is actually more open questions than anything in your mind could be the cause for that, because maybe he has another thoughts that it's not related to this disease at all. Maybe you think that you're not able to travel, he will not able to, he has to change his job, something like that. So you ask about in general, in thoughts. Maybe he has some causes that he think about it or something related to this issue. Then you go to the concern and expectations, and the concerns, anything in your mind, anything in particular that worries you about your symptoms. Are you concerned? What are your concerns regarding this complaint, or any questions regarding to cover this issue? Okay, and you come to the expectations, because if the patient think that I have to do an CT scan, I have to receive take an antibiotics, I have to be investigated more like that, or anything in his mind. And even in our life, we face these patients in the clinic who come to you, and he puts in his mind, I have to do a CT scan on my neck to be sure that these lumps is not present. Okay, So, and there is no cancer, there is nothing. And he just come to you asking for a CT scan, or having a headache and you'd like to do a CT scan. So that's the value of the expectations. You have to know what's expected from us. Maybe he doesn't have any expectations, but another scenario he can have. Maybe something in his mind regarding the expectation. And the important thing that will make you different in asking about ICE, and that's why I say about the active listening, is the reflection. I said something in the concerns, okay, that it may be a cancer, okay, or I might lose my job because I'm feeling dizzy and I'm a driver, okay, or something like that. So this concern, you have to reflect on it, okay? And the reflection doesn't mean only something, saying something like a template, like, okay, I'm sorry to you that it's so early to say something like that, but just add more a little bit. What are you going to do to reassure him? Okay, so yes, I understand your concerns about this complaint, and but it's still early to say to determine the cause of that. But we are going to examine your throat and blah 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 blah. So you are going to tell the patient what are you going to do to exclude this possibility of having cancer, this possibility of something, this like that, like that, like that. If he said, I'm going to lose my job, you're going to say, yeah, actually, you have to stop driving temporarily, but it doesn't mean that you're not able to drive for forever. Okay, so you are dealing with it and you are reflecting on his concern, you are reflecting on his expectation. He said that I would like to do a CT scan, or maybe he doesn't say anything according to. So that's why I say you have to follow the patient, and following the patients mean you have to deal with what he's going to say, and also reassure him or answer it or cover it later, even when you are talking in the management plan. Then we're going to the next point is the time management. And this is a very important point. And I know it's a critical point, especially if the history is combined with other stations, or even in some other stations, breaking bad news, in the consent, anything else. The points that I'd like to tell you is, don't be quicker. I mean, don't take the history, because some people will ask about, okay, I have about 15 questions and I have to ask these 15 questions. So, sir, could you tell me what you have? Okay, any block in the ear nose, any bleeding from any nosebleeds, any ear problems? Have you had any problems like blood pressure, diabetes? So this is a big mistake. When I say you have to manage your time within 7 minutes, it doesn't mean that you're going to ask all of the points that is usually present or cover everything that is usually present, because it will be impossible, believe me. But on the other hand, if you are going to ask it in a quicker mode, and you just going to go through these questions rapidly because you are thinking that I'm in hurry, you lose a great marks, because actually there is no, you affect your communication skills, you affect the way that you talk with the patients. He may not feel comfortable, he may not able to tell you more about, you are in a hurry. Okay, so time management doesn't mean you should take all these points rapidly, but it means you have to be focused. Okay, what does it mean by focused? For example, I will give you different examples. For the consent, for example, when I say don't waste the time in the introduction, because for example, it's according to this to the case. If I have a case for my rhinoplasty, okay, I will give a proper introduction. But in the other way, if I have a case, for example, for the parotid, I will just give a very small introduction, because I'd like to save this time for the other points. Okay, you get it? So this is the issue. For the history taking, I'm not able to cover everything. And I believe that it will be difficult. It will be, for example, in notes, I mentioned all the points for the history of present illness, for past medical history, for family history, medications, so psychosocial, okay, ideas and concerns and expectations. So it will be possible sometimes in some stations to cover everything, especially if the patient is going and talk about something else. But you have to be focused. And what does it mean by focus is to ask about the relevant points in the history. Okay. For example, if you have a lump in the throat, asking about the family history, I don't think it will be relevant so much to this history. Okay. If you have the time, it's okay. But if it will affect your time, I will jump this point, even if I'm going to lose some marks, because I'm managing the whole stations. I have a 7 minute. Okay. So the same the advice that I keep giving is to ask about the most important, the most common cause and the most dangerous cause. Okay. The most common and the most dangerous to reach at all at the provisional diagnosis for this case. For example, for the lump in the throat, I will start by analyzing the complaint, like ask you about, tell me more about it, and I keep in mind while he's talking about the onset, when did it start, the course, is it getting better or worse, the duration, how long he has been suffering from this issue, and is it getting better with eating or not, any symptoms. So this is just the analysis. And the commonest cause, like having heartburn, regurgitation, any anxiety or anxiety or depression disorder. The most dangerous is the red flag signs like dysphonia, dysphagia, any clamps, coughing of blood, referred earache. Okay. Then the psychosocial, smoking, alcohol, and what does he, and what do you do for a living, for the work, and his occupation. So this is the point that I have to cover in this station. Other points, yes, if I'm going, and definitely after this is the and also the allergies and the eyes. So we have these, all of these points should be covered. Again, the most common and the most dangerous, and eyes and concern and eyes and allergies for the medications. So these are the points that I'm going to cover. Maybe other points I will just miss it, okay? Because if we're talking about for any history, I have to ask also about the nose, about the ear, but I don't have so much time to ask about this issue, and it will not add mostly to my diagnosis, and I only have a 3 minutes maximum or 4 minutes to spend with this station. So that's why you have to be focused on the relevant information. The same thing for if you have a patient with hearing loss. I'm going to analyze his complaint, okay? And after an analysis and being sure which is right or left and which is better, ask about the ear symptoms, other ear symptoms, discharge and tinnitus and instability, dangerous like any nasal blockage or neck lump, okay? Then we will go for the other things like any drugs that he took, okay, ototoxic drugs and allergies, and the ICE idea, concern, and expectations, and psychosocial. So you have to be focused and put everything in your mind, follow the patients, and sometimes, the first 30 seconds is the golden time for you, because sometimes the patients will save your time by mentioning points. So you don't have to cover it again. Just build on it. Okay. So for example, when you ask the patients, tell me more about your complaints regarding the hearing loss and say blah blah blah. So he, for example, said that he has a hearing loss for 10 years on both ears, and it's getting worse within time. So you have already all of these questions were answered. There is no value to asking this question again. Maybe you not lose marks, okay, but you lose time, and you need this time. That's why for the time management, again, you have to be focused not to be quicker, not to ask rapidly about everything, and you try to cover all of the points that Osama mentioned in the notes. I have to cover all of them and say every words and all of the sentences, all of the phrases mentioned. No, no, not at all. Just follow the patients. I'm trying to write in the notes what will guide you to just open your minds, but you have to be a natural, and you have to talk to the patients with your own words, put everything in your mind, and follow the patients, follow the scenario, and deal with it. So you will save the time. And the second thing is practicing. When you are practice a lot, you will be able to make it. Don't worry. The 7 minutes you will able to master, or at least as for maybe the 7 minutes finish and you still there's some points you didn't cover, but you covered the majority of the structure of the station. Then we come to the last thing is the hidden agenda. Okay. And the hidden agenda, as I mentioned, it will be covered by when you ask about the ideas and the concerns and expectations. So mostly you go to this stage, these points, and you'll able to cover it. Okay. And the last points I'd like to tell is the last 2 points, actually, not only 1 point, is the medical terms, the jargons. Sometimes we have to mention it, okay? Or maybe I forgot and say something like endoscopy, okay? Or any like epistaxis, for example, okay? Or something like that. It is not a crime to mention a medical term. But if you're going to say a medical term, you have to follow it by explanation, okay? So endoscopy, do you know what is it? It's just a camera with a telescope to look into your nose, to look into your throat. So you're explaining what you have said, okay? And sometimes avoiding jargons too and make your words and sentence more simple, you may end by saying something vague. Like we are going to examine your nose by a tube, and this tube will produce a light and it will record and go through the nose. So even the patients will become, what you mentioned, I'm not getting you. So the issue is, yes, it's the idea is not to mention any medical term, but even if you said any medical term, you have to elaborate. Just following it by ear, but it's not a crime, okay? Anyone can say it because according to, but when you say the medical term, just explain it. Okay, so when you did it, you'll not lose the marks. The second point, what shall I do if I forgot an important question? For example, I took a history for obtaining for example, for lump in the throat, and I forgot to ask about dysphonia, or I asked about the neck lumps. Okay, I forgot it. Okay, and I realized after doing the FNE that I forgot to ask about this issue. Okay, what shall I do? Shall I just ignore it? To no, don't. If this happened, we are a human being, and we can forget it because of the stress of the exam. Anyone can forget any points, but the points that even if you forgot the question, just use again the signposting. So say, Mr. Tom, sorry for asking you these questions because I just missed the points and it's very important regarding your case to know about it. Have you had any difficulty in swallowing in the neck lumps? So follow it by signposting and cover it. It is not an issue, because even the examiner will realize that, okay, you remember these issues and you covered it. It's better than nothing, okay? Because if you for example, forgot a red flag, will really affect your marks, okay? Because you are not a safe doctor, okay? And this is an extremely important. Being a safe doctor is an extremely important. If you forgot to exclude the presence of cancer, and these points affect significantly these patients, definitely you will lose marks and lose a lot of marks. So because sometimes the people say, I will appear disorganized because I've already finished the history and now I finished the examination. Shall I come back to the history? Yes, do it. Do it. Go back and ask, because I believe that everyone, especially in the exam and with the tensions and with the stress, he can forget some points. So it is not a crime and it's not the end of the world. Just go back and using the signposting and cover it. Okay. So this is the points for the history taking. And before I'm going to give some examples for the cases, different cases, but I'd like to ask you if anyone has a question you'd like to ask, especially before we are going for the stations regarding the history taking in general. So I will cover it. Any questions? Okay. So going to share the screen. Yes, we have a question from Dr. Aman. Yes, please.
Hello, good evening, Dr. Osama.
Good evening to you, sir.
Sir, actually, I want to ask that when we make the diagnosis, provisional diagnosis from history, suppose it is a case of CA tongue, carcinoma tongue, and would we like to say like provisional diagnosis is malignant ulcer of tongue, or we'll say that it is carcinoma of tongue?
You couldn't say any malignancy or cancer from the history taking, okay? Because
Provisional diagnosis. Okay, okay.
malignancy mean histopathology, okay? So you are just thinking that you have an ulcers, and these ulcers needs to be investigated more by taking tissues and examined under microscope to reach what is it. But you're not going to talk about is it a cancer or not before having a pathology with you. You get my point?
Okay, okay.
And
After taking history, yes, sir. Please continue.
yes, I'm with you.
And like after taking history, and if we need to examine the patient, like in ideal scenarios, not nowadays as we're not examining the patient. I mean, after taking history, when we examine the patient, we know that this ulcer after examination is a malignant ulcer, like by induration or lymphadenopathy. So our provisional diagnosis will be a malignant ulcer, or we
You're
have to
not
say
going to
carcinoma.
examine the patient. You know, I'm
Yes.
talking about the DOHNS exam, okay? I'm not talking about in general, because, for example, in lab, it's different totally, okay? I'm talking about DOHNS exam. You will have a history taking session, okay? This history taking may be just history, okay? Maybe history with differential diagnosis, maybe history with explanation and talking to the patients and doing FNE on Manican, okay? This is the only scenario that will come in next May exam, because there is no ear examination, there is no, because of the COVID, you're not going to touch any patients, okay? So we will get more in details in the webinar next week, but this is the scenarios that will come in the exam.
Okay, okay. Thank you.
Okay, you are welcome.
Hi, Dr. Osama, I have a question.
Yes, please.
If the patient tell me that he has a dizziness, for example, with hearing loss, sudden sensory nerve, do I have to ask all the question about dizziness, or just what type of dizziness you have and just skip and go again?
You will have to just ask in details a little. So dizziness, if you say, yes, I'm feeling dizzy, so how can you explain to me? Are you feeling everything is spinning around yourself or just feeling unstable? This is enough.
Okay.
But you're not going
This
to
is
take
enough.
a full history from a full dizziness history, okay? It's just a
But
sign.
be sure that it is a dizziness or vertigo. If it is vertigo, typical, do I have to go further or not?
No, because you don't have a
No.
time.
Okay.
That's why I say you have to be focused. Okay. And what do you mean by asking more about the dizziness? What are you going to ask more?
For example, if it is episodic or constant, if there is if it increased by head movement, if it is increased by loud sound. question like this.
This is perfect. This is perfect. But if you have a time, but you do not have a time for that.
Okay. Okay.
So if you're able to do it, but I don't think so. You're able to do this with the time, because the time factor is
Okay.
very important.
And also for a history of hearing loss, if they ask for sudden or non-sudden hearing loss, sensory neural, do I have to ask him about general condition? Do you have any medical condition, or I have to mention, do you have autoimmune disease? Do you have neurological disease? Do you have hypertension, high blood pressure? Or just if I don't have time, can I ask him one question? Do you have any general condition and stop?
No, you have to cover.
We have to cover this.
It's because medical condition, maybe the patients will not get it, and maybe you will not think about what you meant. What do you mean by medical condition?
Oh, so we have to ask about all related medical
Will
condition.
not take a time. Don't worry. If
Okay.
you are well prepared and you practice a lot, put it in your mind.
Yes.
And we will try. I will try today to do it with you, with all of you, with time, okay? And we'll try to just show you how we're going to manage these stations. Okay.
Okay. Thank you.
Okay. Another point is about the double question. Okay. I talked about it before. Sometimes you may think that I'm going to ask a double question to save time. Like, do you smoke or drink alcohol? Do you have blood pressure or diabetes? Do you have a nasal blockage or nosebleed? And you are thinking that you are saving time, but actually this it will not cover the points that you have, because if the patient say no, you are not sure no for which complaint, for being smoker or for taking alcohol, for having a nasal blockage or for nosebleeds. What does it mean by no? Okay, so you have to ask each point separately. Don't double your questions, okay? And that's why I say I understand that the time is a great burden on all of us, but it doesn't mean that you're going to to make the communications worse, like using all of these techniques. Okay, so any questions? Okay, so we have this scenario, and I think it's a common scenario, and this is the 30 and I'd like someone to just to volunteer for being a patient. Okay, Dr. Osama, okay. That's fine. So for these stations, and this is a common station, and understand it's a big headache for all of you. So we're going to obtain a history and explain the management plan and explain the flexible laryngoscopy. So we'll try to do it in 6 minutes, okay? And to show you how to going to obtain a history and also explain the management plan. For the management plan, you just use the points that was mentioned by the patients to talk more about the treatment plan and what you are going to do and what are you going to do for everything. Okay. So, Sam, are you? Where are you?
Yes, Dr. Sam.
Okay, that's fine.
Are you copying me?
Yes, yes, yes. So
Okay.
we're going to start the session. Okay. So let's go on. I'm Dr. Osama, one of the ENT doctor who works in the hospital. Can I check your name and date of birth, please?
Yes, of course. My name is Oliver Jonathan. I born in 1980.
Okay, and how do you prefer to be called?
Oliver, it's okay.
Okay, Oliver. So I understand that you have been referred to us because of feeling something in your throat. Perhaps you could tell me more about your complaint?
Actually, I have since more than 6 months, feeling of something in my throat,
Yes.
which come and goes, but really bother me in the last few weeks.
I understand. So it is for 6 months right now.
Yes, it started since 6 months.
Okay, and does it getting coming in episodes or it's continuous? You say it keeps going, coming.
Yes, it's coming episodes.
Okay,
Yes, that's
okay.
right.
Do you feel it's better when you are trying to swallow something?
Sorry, what you mean? You mean during eating?
Getting better with eating?
Yes, I don't have any problem during eating.
Okay, and some other questions regarding, have you had heartburn or stomach issues?
Yes, sometimes. That's right.
Sometimes, okay. And regarding your complaint, there is some important question also that we have to ask about. For example, the change of voice. Have you had any change of voice during this time?
No,
Any neck lumps or swellings?
sorry, I don't notice any clumps.
Okay, any earache, have you had it?
No,
Okay, and have you had any thoughts in your mind for your symptoms?
really, I want to be frank with you. I Google it and I read terrible things. I'm afraid of having a cancer or something like that.
Yes, I'm sorry to hear that, but you know it's still early to determine the cause of your complaint. We will go and investigate more by examining you, and we'll try to exclude the presence of anything serious.
But I still feeling there is something stick in my throat.
Yes.
I'm really concerned about it.
Okay, okay. We will try to cover it, Oliver, okay, after examining you. But there's also some questions about your general health. Have you had any blood pressure disease?
No,
Heart or diabetes?
no, I don't.
Okay. Any anxiety or depression disorders?
Yes, recently I have some pressure in my work.
Okay, I'm sorry for that. Okay, and any
Due
other
to the general lockdown and COVID issues.
Are you on any medication right now?
No, except I have allergy.
Okay, and some personal questions. Are you a smoker?
Yes.
How many cigarettes per day? For how long?
About 10. Since many years, about 10 years, more than 10, 12 years.
Regarding the alcohol, are you taking alcohol?
Just in weekends.
Just in the weekends. Okay, and what do you do for living, Oliver?
I work in a restaurant.
Okay, so Oliver, according to the
as an accountant, yes.
As an accountant, okay. So according to the point that you mentioned that you have this feeling of sticky in your throat, and it's for 6 months and keeps comes and goes. Okay, I think that we need to examine your throat. Okay, to look more in details about to see if there's anything really in your throat. Okay. And after examining, you will determine if you're going to need to ask for some scans or anything else. But also there is some issues related to your habits like smoking and alcohol, okay? Because we have to also manage and try to stop smoking because it will affect also the general problems of use, okay? Right now, I'm going to examine your voice box using flexible nasoendoscopy. Have you done it before? Or do you know it's actually?
No, I don't.
Okay, it is a thin telescope, okay? And we're going to introduce it through your nose to look into your voice box, okay? And after that, you may feel uncomfortable.
Is it? Yes.
Okay, but we will.
Is it painful?
No. It's just feeling uncomfortable. And that's why you're going to spray something in your throat, okay, to cause a little bit some numbness. But if you are feeling too uncomfortable, just let me know and we stop doing it. Okay?
Okay.
Okay. So Thank you. So I finished, and now I'm going to examine, and I still have around 20 seconds and 1 minute extra. So let's discuss about this case. I think we covered with Osama started by, actually he saved my time because he mentioned his complaint and he mentioned the duration and mentioned the onset of everything. So I saved my time from asking this issue. Then I go directly to the other things like the heartburn and the red flags, okay? And after asking the red flags, we expose the eyes and I reflect on everything he said regarding his ideas, regarding his concerns, and go directly to just rapidly for the medical history and for the medications, the allergies, and for the psychosocial history, okay? Then explain to him what I'm going to do, the nasolaryngoscopy. And I think if you have one and a half minutes, it will be enough for you to do the flexible laryngoscopy. So you'll able to manage it, okay, for the time within 7 minutes, okay? And I'd like to receive any questions regarding these stations. I try to make it, give you an example. And for example, Osama raised some issues and raised, so I have to stop, okay, and deal with the points he raised. I understand that I'm tricky because there is a time and these times keep ringing in my head, but I have to respond to his concerns and to the points he mentioned. Okay, thank you, Osama. And any questions?
Thank you, Doctor.
Anyone would like
Dr.
to ask?
Osama, according to this station, Dr. Osama, feeling something in the throat.
Yes.
In red flags, also you asked about change of voice, new neck lump, but you don't ask about ear pain, coughing blood, something like this.
I asked about the ear pain, but I didn't ask about the dysphagia because he said that he doesn't have a problem with swallowing. Osama, you said this issue, I remember. So Osama already said that he doesn't have a problem with swallowing. When I said when you are swallowing and is it getting better? So I say, no, I don't have a problem with swallowing. So I didn't ask about the dysphagia. He's already said it. So I just asked about the dysphonia, about the neck lumps, and about the earache.
Yeah, thank you.
Okay, you're welcome. And this is the point, Dr. Muhammad. If the actor mentioned the points, and this is the value of active listening, and that's why how we're going to save your time. Okay,
Yes.
so you're not going to repeat the question, and this is will save your time.
Yeah.
Okay. Station and complete laryngoscopy. Yes, but I don't have a flexible with my hand. So that's why I did the station actually within 6 minutes, not a 7 minutes. Okay. So for the station, you're going to explain it. Okay. The introduction that I give it. Okay. And after that, you, for the real exam, you will see a video, for example, in the website, but the first thing you're going to check if the lights is working or not. You will sanitize it and you will apply gel, okay? Then you will ask the patients which nostril are going to go. Then you will introduce it. And while you're introducing, you will say, okay, now I'm inside the nose and I'm seeing the nose, the nasal cavity. Then I'd like you to start swallow. Then you go to the voice box, say E, puff your cheek, stick your tongue outside, then you go outside. These are the steps. It is, and I think 1 minute will be enough for it, for the flexible laryngoscopy. Any questions? Yes, Sama?
Sorry, Dr. Osama. Regarding the last point, explain the examination. You will perform a flexible laryngoscope, nasal laryngoscope. Do I have to explain what I see to the actor?
Yes, while you are doing the FNA, you have to talk to the patient.
From since I enter the nose through the nasal cavity, no septal deviation, no postnasal.
Yes. Now I am inside the nose. Okay, I'm saying this is the nasal cavity. Now I'm going to enter your throat, I would like you to start swallowing. So you pass the nasopharynx. Now I'm looking into your voice box.
Yes.
Okay. Kindly take your breathing. Yes. Say E. Puff your cheek. Stick your tongue outside. Okay. Okay. That's fine. Now I'm going outside. Okay. Just suddenly. Okay. Then you get it out. So it will take less than 1 minute mostly because first you are doing in mannequin.
Very well.
So there will be no discomfort. You just go through. The mannequin will not be
Yes.
like the real patients. So don't worry about it. Okay.
Of course, yes. All right. Thank you.
We did the station in 6 minutes for this issue to just cover. And I hope that I give you an example. So any issues would like to ask me about it? Okay, so we will go to another station. I'll also give you an examples of it. Okay, so the issue that also I'd like to emphasize that you may even forget some points, but try not to forget something important. For example, in these stations, I forgot now. I didn't ask about the family history. Okay, maybe it is of value, but sometimes I keep focusing on the most important and the most common and everything relevant to this complaint. Okay, because if you have to ask about everything, I think you will face an issue at the time, and this is the trick in this station. Okay, so we have another case for the nosebleeds, okay, or hearing loss. We can do, for example, the hearing loss. Okay, we will do it for the hearing. Which would like to practice with me for the hearing loss?
Okay, Dr. Samuel.
Okay, Dr. Muhammad. So you will be the patient for this hearing loss. So for these stations, when it came before, be a history taking, then we will have two scenarios. Either the first scenario is the Weber was to the left side, the RNA negative, RNA positive, and we have an audiometry of total hearing loss, okay, on the right ear. Or we have another scenario, which is actually a high frequency hearing loss, presbyosis, that may come with these scenarios, and how we're going to explain it to the patient. So for this station, it was also 7 minutes, okay? And you can check any of these scenarios if you're going to say 3 ears or 1 ear, and accordingly, I'm going to explain it, everything. Okay. So, Bismillah, we have a 7 minute.
Okay.
Okay, I'm Dr. Osama, one of the EMT doctor who are going practicing in the hospital. Can I check your name and date of birth, please, sir?
Yeah, I am Tom Bain, born in 1942.
Okay, and how do you prefer to be called, sir?
Tom is okay.
Tom is okay. So I understand that you have been referred to us because of hearing problems. Maybe could you tell me more about your complaint, please?
Yeah, really, I have some issue on my hearing. This is a long time before in both ears, and I still suffering also.
Okay, how long have you been suffering from it?
This is many years, maybe more than 10 years.
More than 10 years. And you tell me it's on both ears. Which ears is better?
I don't know, because I have the same problem in the both sides.
Both sides. Okay, and does it started suddenly or gradually? And
I thought this is gradually.
Gradually, and it's getting worse.
Yeah, getting more, yeah.
Okay, some other points I'd like to ask about it. Have you had any discharge or pus coming from your ear?
No.
Okay, any ringing or sounds, internal sounds in the ear?
Yeah, I suffering also from ringing, yes, in the last some years also.
Okay, and have you feel any instability or dizziness?
I feel, but it's maybe from my age.
Okay, related to the age. Okay, and also I'd like to ask some questions that to be sure that everything is okay. Have you had any nasal problems like a blockage?
Sometimes.
Sometimes in both nostril?
Yeah, this is seasonal, maybe.
Seasonal. Okay. Any nosebleed
No,
or neck lumps?
no,
Okay. Now I'm going to ask some general question about your health. Have you had any medical issues like blood pressure?
yeah, I'm in treatment for the blood pressure last 5 years.
Okay, and it was well controlled.
Yeah,
Okay. Any have you had diabetes?
no,
Okay. Any surgical operations was done before to your ears?
no, no.
Okay. And are you allergic to any medications?
I don't know until now.
Okay. And what do you do for a living, sir?
I'm a teacher.
I'm a teacher. Are you exposed to noise and sounds frequently?
You know, no more
Mhm.
sound.
Okay. Now I'll ask some personal questions that may impact your life. Do you smoke?
No,
Okay. You're taking alcohol?
no.
Okay. Any thoughts in your minds could be related to your symptoms?
Really, I have a usual with this problem. Maybe I tell you more than 10 years, but my concern is getting worse in the last years. I don't know what's the problem, and also I fearing from disease in my hair itself.
Okay, okay. And yes, I understand your concerns, and we're going to investigate more and say, examining your ears and to determine the types. And the last question about, have you had these conditions run in your family?
My uncle only.
Your uncle. Okay, sir. So now I'm going to examine you to see everything regarding the issues. And I have the results for your hearing test. Is it okay to discuss with you about the results?
Yes. Yes, I do it before 2 days before.
Okay, so we did the test actually, and we found that you have a problem with hearing in both ears. Actually, the hearing is on different frequencies, okay? So as you see in this diagram on the right side, on both ears, we have a low frequencies on the left and the high frequency on the right. And actually the hearing on both sides affected onto the right. What does it mean by the high frequency? It's actually something common, and it's common. It's one of the commonest things in the hearing loss, and it may be related to different factors, maybe related to the noise that you use exposed, or maybe related to the age, or related to other medications. Okay, so the problem that you will have with the hearing is you will not able to detect some sounds, especially if it is in a crowd, okay? And some high-pitched sounds like the birds or the females or something like that, okay? And also you may get also these ringing sounds or noise that you mentioned before. Are you is it clear so far to you?
Yeah. So this is a problem with my hearing. Also, this ringing sound. So it matching with my problem.
Yes.
The loss of hearing also me causing this problem of ringing.
Yes. And as I mentioned, it's actually related to different factors. The age, the exposure to the noise, and also family history also plays a point on it. So the options for us to treat this, we can offer you, if you are suffering from this complaint, a hearing aid with different types of hearing aid. Try to correct this affection in the hearing and improve your ability to detect the sounds. And it might resolve also the ringing and the noise that you have.
Okay.
Okay.
Not escape from this from long time. Also, I can continue without hearing aid, no problem.
It's according to your situation. How does it affect your life? Are you able to communicate well with the others?
Yeah. I don't suffering so much.
Okay, it's actually your life is not in danger, and the point is to improve the hearing and your ability by providing you the hearing aid. To summarize, what you have is actually a high frequency hearing loss in both ears, and this is will be treated, will be managed by offering you a hearing aids to correct this problem.
Yeah, thank you.
Okay, thank you, sir. So we have three, time is over. So thank you, Dr. Muhammad. And I hope that I try to cover everything with hearing loss. He said about it's both ears, okay, so but he start by for a long time. That's why I ask about specific things. I ask about the duration, say for 10 years, and also about ask that is it gradual or it's a sudden onset, and which ears is affected more. Then we cover the other hearing symptoms, okay, and the other nasal symptoms. There is other issues actually I didn't ask about, and you will say it's for the autoimmune disease, for these things, but it will not be much related to this scenario. And also I have a time that I have to cover, okay? So I just covered the history of present illness, and with the most common and the most dangerous, the most dangerous actually is for also getting a dizziness, okay, and having a nasal symptoms and nasal blockage. But Muhammad said that it is just an allergy without nosebleeds. That's why I just, and he doesn't have a neck lump, so I exclude the presence of these serious things. Then we went to the past medical history and the surgical history. For hearing loss, for example, family history is relevant because, for example, for this presbyculosis or hearing loss in general, we have a familial hearing loss. So you have to cover it, for example, in this issue, and forgetting family history will affect you. And also ask about the antibiotics and the medications and what the medications he has and the allergies and the eyes. And eyes, definitely you have to cover it beside the other habits of smoking or alcohol. Then we go to the explanation. This is a total explanation. It is not necessarily being a breaking bad news, okay? It's just an explanation of the audiogram. Maybe if they choose the other scenario, I will do a breaking bad news. And when I'm doing a breaking bad news, I will just start from, I have the results for you to this. Is it okay to discuss it with you? Okay, so however, I'm sorry to tell you that the result is not as much as we hope. And it shows that actually the right ear is totally deaf, affected. I'm sorry to tell you that. Then you will resume. But the only things that you're going to mention in the second scenario is that we are going to request an MRI. And why you are going to request an MRI? To exclude the presence of acoustic neuroma. And the management will be the same as the scenario for the kids, BAHA or CROSS, okay? But for the high frequency hearing loss, I'm not going to request an MRI because this is a typical presbyculosis. What's the value of MRI? Okay, so, and it is not even a typical sensory neural hearing loss. So this is the two examples of the combo stations, okay? And you know, the issue is just put it in your mind and be flexible and follow the patients, and everything will be okay. You will not face a great problem. You will cover everything. Okay, so any questions? Okay, anyone would like to practice? Raise your hand. You can give 3 or 4 stations for anyone who'd like to practice, at least for today, for the history taking. No one want to practice at all? Okay, we have Aman, we have Osama. Who else would like to practice? I will take 4. Who would like, raise your hands, please, if you'd like to practice. Muhammad, okay. So we have 2, Aman and Muhammad. Okay. Okay, so anyone else would like to practice also? Okay.
Me, Dr. Osama.
Okay, and Dr. Halima. Okay, so we have Aman, Halima, Islam, and Muhammad. Okay, 4 stations. Let's go ahead. So, Dr. Aman, I think you'd like to practice history taking or anything else. I'd like to do history taking, or anyone would like to practice something else, but I prefer to do history taking. So you try what we mentioned.
History taking.
History taking. Okay, so okay, so let's do it. Feeling something in the throat. Okay, or we just do do the next one. Nosebleeds. Okay, so you have a 6 minutes for this scenario.
Okay.
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 We are going to obtain a history, then you will explain the flexible laryngoscopy and everything. So 6 minutes you have. Kindly go ahead, please. Just a minute. Just a minute. Okay. So
Okay.
stop record.